Good afternoon. I'm speaking to you live just outside.
I like to think balding is just God's way of saying, now let's see you get laid.
Is it true that if you don't use it, you lose it?
What I'd really like to do is put the greatness of this man in perspective.
The hairloss community has a lot to be thankful for, having you as a spokesperson.
You mean you just call this guy up?
About life and about reality.
And now, America's #1 reality radio show for men. Live from Los Angeles, it's Spencer Kobren's The Bald Truth.
You know, it's so funny. When I embed the program, I don't even know. I get confused sometimes if it's the right embed because I'm always wearing the same clothes, same blue shirt.
There's no visual cue, and I'm always wearing the same black shirt. So
yeah, I'm like, is this new? Do I have a fresh bandage on my eye, and I think it is. Guys, we are live. Phone number 888-659-3727. It is so great to be back. I had a few days off last week. I decided to fly to an undisclosed destination to get the F out of here. And I have to say, I haven't drank that much in a very long time. Not good,
it's
Joseph.
Good to be back.
You know, honestly,
no,
it reminds me of why I choose to really practically be a teetotaler at this stage of my life.
A what? A teetotaler?
Yes. Someone who does not drink on average, usually. I'll order iced tea.
Ah, got it. Yeah, that wasn't me last weekend. Unless it was Long Island tea, right? Oh. Anyway.
Long Island iced tea. Effed up the joke. Guys, the phone number 888-659-3727. But, I do find, honestly, hotel bars a lot of fun. Because, everybody's lying. Everybody's BSing about their situation.
Oh, yeah.
And you see all these, married business guys essentially on the make. And this is what I think to myself. When I was in that situation, which was great for a very long time in my life, if a, 25-year-old sat next to me and started to chat me up, I would think that I was being set up by common law. So just like everything else in life, everything I do in life, I act as if I'm being recorded.
Mm-hmm.
I actually think that I did embed the last week's show. That's hilarious, man. How is that even possible? Let me try to redo this.
It happens.
But yeah, so I'm just watching all these guys. I'm kind of, I'm talking to people, whatever it is, and this guy is talking to me about his wife. Meanwhile, he's asking me about this piece of A over here, my thoughts on her. I'm drinking. I'm having a good time. It's funny to me, but I'm thinking the ramifications, the possible circumstances that this guy would be under. If Kevin Quinones, whatever his name is, came out and was like, this is an episode of What Would You Do? Because that's always on my mind.
Yeah.
I think about, people don't think about they don't think about the consequences in life. It's amazing to me. And that is a segue into the reality of this effed up industry.
That was nice. I like that.
These people, young and old, but mostly young, and I will embed the right feed into the Bald Shoe site in a second once Joe has a thought. They have no clue what they're getting themselves into. I happened to watch your broadcast, I think it was yesterday, with IAHRS accepted member, Dr. Joseph Yeager. I have to tell you that, I mean, he is, first of all, he's an effing natural on camera. This guy is just,
Yeah.
he crushes it. And he really is not, and this says, I'm not talking about any other guests that you may have had, but I've had a lot of guests and a lot of people over the years. He's not a guy that's about himself. It's not me or what I've done or what we've done or it's like, this is my approach to things. And was very honest about, patient selection, very honest about FUE and FUT, very honest about his thoughts on oral minoxidil. It was actually unusual to see just how kind of straightforward he was, and also the way that he approaches patients and the way that he's, I think, describes the process to patients and what's going to go down. Incredibly unusual. But my point is to that is he's one of the guys that's very aware of, and he's a young guy. He's like, I think he's 40 years old or something like that. He's very aware of what these kids are getting themselves into. And he's unwilling to approach them, offer them surgery, unless not only do they know the possible consequences of not taking medication or starting the process too early, but he may not even treat them if they're not on medication.
Yeah.
And
he wants to arrest it as much as possible.
But he spoke about, and people don't speak about it, it's the future of hair loss. This is just a waiting game until the end. And the end is never good. But, what we're waiting for is, we're slowing down the process using medication. I've talked about some changes that I've seen over the last few years and very recently. And, we're hoping to extend the lifespan of our native hair, and if you're moving hair from one place to the other, of the transplanted hair. And the young guys that are going out and they're going overseas or anywhere and getting these massive cases, they are not giving themselves the opportunity to really enjoy a relatively fullish or full head of hair for an extended period of time. And a lot of times they're destroying that opportunity because they're utilizing too many grafts. They may be losing grafts early on that they have no idea that they're losing. They're having grafts moved from unsafe areas. They choose not to take medication. They're making a choice between meds and surgery. And you don't know, I mean, you know, but listeners, you have no idea how often this comes across my desk where these guys are adamant about using any type of medication, especially oral medication, which I'm going to be honest, according to every expert in the field, except for people who are just trying to sell a product, it is the most effective way to treat your hair loss is by taking systemic treatments. Mm-hmm. So those who are refusing to do this, and I understand why they would, they have to understand it's not one or the other. It's you got to do both. Otherwise, you're back to, the hair transplant industry of the 1980s.
Well said.
And that's it. Joseph, give me your take on this. I'm going to embed your show onto my website.
That would be our show.
Whatever.
Not just my show. Unless you're talking about the main event. Thank you very much.
I really don't know what I'm talking about.
No, but what you're saying is exactly true. And when I'm perusing the socials, as it were, I've been back on Facebook on one of the hair loss groups there, and I saw a parent in this group asking about a certain doctor in a certain country.
Did you say parrot?
Yes. Yes, and her name was Polly. No, a parent.
Well, I would believe it.
Whose child was not only going to this foreign country and, to have a surgery with this specific doctor, but the mother and father were going with him. That's the first red flag. And they were asking the group
not good,
if
Janet.
it was safe.
Sorry,
if it was safe to go to go to this particular country, not the clinic.
Just
And
the
I thought
country
to
as a
myself,
whole.
Yeah, just the country as a whole. And it's not the obvious choice, the obvious guess that's south of Europe.
So what, like
I'm not
they want to
gonna
go to
name
like Romania or Bulgaria or some shit?
No, wrong hemisphere.
Mexico.
And they just wanted, no, they wanted to know if it was safe, and they
Colombia.
weren't talking about the clinic, yes. And and what caught me as being strange is at no point did they ask if the clinic was okay. They said, yeah, we did our research, but it's like, what kind of research? So I asked, I said, well, are you looking for the best deal for your son, or are you looking for the most natural result? And they came back and said, we want him to be safe. The hell does that even mean? Okay,
Well,
you don't want him to get robbed and shot. Okay, great. But do you want the result to look good? Do you want him to be mentally in a good place once the surgery matures and grows in? Like there was no discussion about the surgery itself, the long-term ramifications of a bad result. They had zero concerns about that whatsoever.
Well, not
They
to
were
sound
just
like
concerned
Captain
if
Obvious,
it
my
was
man.
safe.
Not to sound like Captain Obvious, but I mean, come on. We've been doing this for a long time. Nobody knows shit. Period.
Why? Well, it's
No one knows how to
it's
do
a
the research.
continuation of your point.
Parents are willing.
I know.
Parents are willing. I know you know. I'm making a point here for our listeners. Parents are willing, in their false belief that they're helping their child. It's kind of like enabling these kids.
Yep.
To pay for, to offer, to even bring it up to these kids who weren't even considering surgery. Like, you know what, we'll pay for whatever we'll pay for your surgery. You're not getting your kids a boob job or a nose job. And that's what these people don't understand. That's why, I mean, listen, there's a conference going on here in Los Angeles right now. And all the same happy horseshit's going on. People come in, they pat themselves in the back, they give a talk, they take photo ops. There's booths, and people are selling shit and selling, their wares at these places. And they're going to talk about all the bad results, but nothing is going to get done. And frankly, at these conferences, they end up talking to people who are just supporting the same and continuing to support the same evil bullshit and misinformation and misguidance that goes on in this industry. Like, I was talking to a doctor that's presenting, really nice guy, by the way. And I just happened to say to him, listen, I mean, I know everyone wants podium time. It's great to be a part of these things. But do you even understand what you're involved in? I mean, there's nothing nothing good comes out of this, unfortunately, except, maybe you get a little tidbit of information here or there. And you get to put on social media that you were at this conference. But no one's doing anything to evolve the fucking field. Sorry, Joe. No one's doing anything to evolve the field. And frankly, they are willing to work with and have sponsors that have been, sadly, not great for patients or the field. The whole thing is just, I don't know. Frustrated, I guess the word would be.
That's a good word.
At a loss for words to some degree. Like, then the person that I was speaking to great guy, but sent me an image of somebody that he decided not to do surgery on, who ended up getting surgery, well-known celebrity, got effed up, and he's talking to me about this. And I'm like, I want to shake him. Like, how do you think this happens? Not just because you turn him away. It's because all of your colleagues are supporting all of these resources that are supporting misinformation, just selling hair transplants. That's why it happens. We have a full board, 888-659-3727. Let me see if I was able to get this in bed correct. And that means you
think
can
you do.
talk now.
Yeah,
see.
I'm about to work into that.
I know you're
There's some
tired. You did
funny-
four live shows alone. That's not easy.
Well, the last one was particularly difficult, but they're fun. I got to tell you, I'm really starting to have fun with this when it works.
Listen, if you want to pay me, I'll produce them. I'll bring both. I'll bring you and your guest in. We'll have all kinds of cool special effects, whatever you want. No problem. You just sit behind that microphone.
Well, my next evolution is to have an AI generated avatar of myself that can respond in real time. I don't have to sit here anymore. It's possible.
Yeah, it is possible.
Yeah, and it's scary.
Pretty nutty.
So,
good thing. Well, good thing I don't need to do this for a living. 888-659-3727 is the phone number. Let's see who this is. Hey, you're on the air. Who's this and where are you calling from? Got to turn down your radio. I mean, your radio. Jesus, your computer.
Sorry?
Hi.
This is Adam from Wisconsin. Hi.
Adam from Wisconsin. What's
Hello,
happening,
Adam.
man?
Hi, guys. I just had a question about microneedling and more specifically the possible permanent damages that it can do. I just want to get some information in your guys' intake on it and just kind of like what I've been hearing.
Well, tell me what you've been hearing, and
basically,
I'll tell you, because I had an interesting conversation with a pretty well-known hair transplant surgeon this week about this very topic, and so it's fresh in my mind.
Awesome, yeah. I guess put it in, just a simple, it's just I just hear that it could permanently damage your scalp if I don't know if that's at a certain depth or at a specific depth that maybe even just doing it too often. But that's just kind of what I've been hearing. Kind of like
this is the reality, and that's if it's done short term, like if it's done with or short term, if it's not done often, meaning that if it's done to, what's the word? Not initiate, but to what is it called with PRP? When you start up, ramp up, when you activate. If it's done to kind of activate PRP treatment, if it's done, once or twice a year, 4 times a year, something like that, it's very unlikely that you're going to cause any permanent damage to your scalp. It's those who are doing it essentially as part of their treatment regimen on a daily basis or several times a week to the point where they're causing, significant redness, some bleeding, things of that nature. I've heard, and I had a conversation with this doctor this week that said that people who are doing it themselves on a regular basis seem to be causing some damage. And they're starting to talk about this at the conferences. So
now, is this permanent damage, or can it be?
Well, if you're going a little too deep, if you're causing yourself to bleed, even though these are micro channels that should heal with more collagen, theoretically, and they probably will if you're only doing it a few times a year with another treatment, and if it's being done by a professional, then no, there shouldn't be any permanent damage. But a lot of guys are doing it pretty aggressively. They're doing it on a regular basis. Maybe they're doing it 200 days out of the year or 150 days out of the year. And eventually they can cause some, micro fibrotic tissue that could eventually, possibly, interfere with surgical hair restoration.
Yeah, and that kind of brings me to my next question is, let's say, I guess I'll tell you my experience with it. I was microneedling with a 1.5 millimeter, and I was doing it. I haven't done it for over almost a year now, but when I was doing it, I was doing it for a year and a half, 1.5 millimeter, and I was doing it once weekly. And I was
even the most aggressive docs who are doing it through the PRP, they're not using more than maybe a 0.5 or a 1 millimeter, needle depth, and 1 millimeter is large. It's usually about a half of a millimeter. And these are the guys that are doing it aggressively with these micro pens, micro needling pens. So 1.5 is pretty deep.
Yeah, and that's what I had. I had this. It was like this adjustable setting where you could adjust, how deep you wanted it, and I just used 1.5 just because I was just at the time that's what everyone was saying. That was big on microneedling.
Like everyone on the message forums and Reddit and stuff like
everyone
that?
On Reddit.
Or doctors.
Bro stuff.
Yeah, them and the YouTubers that, I'll watch, that I used to watch. I don't go on those forums or even really watch any YouTube videos on here anymore. But yeah, pretty much just the Redditors and the YouTubers.
Yeah, just to let you know, I mean, any doctor that's actually providing the service, unless they are trying to heal scars or remove stretch marks and stuff like that or lighten them, they're not going to go past 0.5 millimeter in depth, especially for hair. So if someone was to go to get PRP treatment, for instance, you're going to see the guy's roller. It's going to be a 0.5 millimeter if he uses an old school roller, or almost every guy who's using a micro needle pen will go to the 0.5 depth. Now, I'm not saying that you cause yourself damage, but there's a reason for it, that the hair doctors only go a pretty shallow depth, and that's because of that concern.
Yeah, and I'm just worried that maybe I might have done some scarring, and maybe that's possibly the reason why I'm not getting any regrowth. I mean, I know regrowth isn't with medication. I'm on dutasteride and minoxidil, and I've been on that for quite some time. And I guess I've just been worried lately that maybe there's a chance that I haven't been getting any regrowth because I might have permanently done some. I might have done some permanent scarring in those areas that I'm concerned about, and I guess in a few years or maybe even closer to a decade, if I ever do consider a hair transplant, let's say I did do some scarring, is it still possible to do a transplant on a scarred, scalp area?
Yeah, I mean, if you were to have caused any type of fibrotic tissue to develop, it's still relatively shallow, and not every area that you microneedled is going to be scarred, in quotes. And hair transplants can grow well in significant scar tissue. So whatever minimal scarring that may have happened from your microneedling, it probably won't interrupt, 100% of the growth. Now, I was talking to this hair transplant surgeon. He says that he has had, and he brought this up, cases where it's been significant. These guys really went to town, and they were probably not doing it once a week. They were probably doing it more, and they were super rough on their scalp, and they just abraded the hell out of it on a consistent basis for well over a year or more. So while I think I don't think it's going to be super common. I don't think a lot of people are going to end up scarred, but it's possible. And I don't think, based on what you told me, that you're going to have any problems with hair transplants down the line. But, Joe has direct experience with this, and I know that he's probably consulted with patients in the past who've done this. So maybe Joe could respond.
Well, I've done more. Well, I've done more than that. I've been, had surgeries or patients that have had surgeries after derma rolling, and there wasn't any sort of negligible difference. But when I think about this and the scarring and damage it can cause, I always think about some of the worst cases I've ever seen of scarring where a transplant was successful. When I say the worst cases, I'm talking about patients that come in where 70% of their Norwood area is just a sheet of scar tissue because of an oil burn that they got when they were 4 years old, knocking a hot pan of oil off the oven and burning the entire top of their scalp. That's thick scar tissue. That's that's quite thick. Microneedling is nothing compared to this, and I've seen good growth, 3,000 graft session. There's a patient that the one patient I always think of. He's from Italy. His entire scalp was burned, very thick scar tissue, and he had 2 surgeries via FUT. 3,001 surgery. It grew amazing, almost like it was on some sort of hyper growth activity. It was really bizarre how good it looked, how full it looked. Came back, did another session of 3,000 grafts behind it to continue the coverage. Fantastic. He wound up having a 3rd surgery, and to this day, you can't tell a difference from him versus any other home run superstar hair transplant patient. It's beautiful. So if that doesn't answer your question, I don't know what does. It shouldn't cause any problems when it comes to surgery. Granted, everything else goes fine, unrelated to your past microneedling experience. Yeah, it should be fine.
And just so you know,
it will be fine.
It's also probably, and again, we're not doctors, it's very unlikely that whatever, in quotes, damage that you've done to your scalp, you may not have done any damage, and it's unlikely that's affecting your hair growth. You didn't do it for that long. Even though you were aggressive as far as the needle size, you were doing it once a week. There's still relatively small channels that you're creating, so
yeah.
I wouldn't be too concerned about it. But I just wanted to put it out there that I did have this discussion, and it does happen. Some guys they just go to town. They go nuts. But under normal circumstances, it should not be an issue.
Yeah.
Yeah, I remember at one point I was, this was probably at my worst when I was dealing with this whole hair loss. I remember fucking just it was a pen, and it was an automatic pen, and I just remember just drawing on my head with these needles that are going out super fast RPM, dude.
Yeah.
But they do that. There are people, during PRP sessions, there are some doctors that use those pens, but they're not going 1.5 millimeters deep. That's the difference.
No.
But even 0.5 millimeter could hurt like hell, especially if you're just going, back and forth, kind of drawing it the way that they instruct you to do it. And it could
hurt me like hell.
Yeah, it could feel very aggressive. And even 0.5 millimeters is, believe it or not, because the scalp is so vascular and there's so many nerves, it can actually cause temporary nerve issues in some people, even that, short of a depth. So, but yeah, I wouldn't worry about it. You weren't doing that for a long period of time. And it has been proven that these micro channels do, and I can find a lot of studies on this, do close on their own without any fibrotic or without any scarring.
Mm-hmm.
So I wouldn't be too concerned about it.
Okay. Awesome.
All right, brother?
Yeah.
All right.
Thanks, guys. Yeah.
Good luck. I hope we made you feel better.
Thanks for calling.
Yeah. Thanks
right.
for the program, guys.
You got it.
Appreciate
Take it easy.
All right. Bye-bye.
888-659-3727. But I've read about guys, and I've seen it, they're using they're going 2 millimeters deep.
I was going to say 2 millimeters deep, and they got pictures of their scalps. It's all bloody, and they think it's progress. They think it's a good thing.
Yeah. You will get bloody if I'm 0.5, especially with these aggressive pens. But that's a relatively safe depth, and that could be painful for people.
When I had my PRP, 7 years ago with Dr. Cooley, when I was visiting his clinic, he gave me one of those 1/2 mil rollers with the big handle. You're like this.
Yeah.
That thing hurt.
Yeah.
That was painful. I was like, well, I gotta keep doing this shit.
That's
it was painful. Yeah.
Yeah, but that's what the hair docs are using. That's in their protocols. The 1/2 mil.
Yeah.
That's it. You don't want to go any deeper. All right, let's take a phone call. Hey, you're on the air. Who's this and where are you calling from? Hey, caller.
Oh, hi. It's Carolina. Can you guys hear me?
Carolina, how are you?
Carolina, hey.
Good. Hi, guys.
Welcome. What's happening?
So, happy Friday. First.
Happy Friday.
Happy Friday.
Second, I wanted to call. Thank you. I wanted to call and share with you guys an experience I recently had along with my husband. we went to see a dermatologist here in Newport Beach because we saw a post of hers where she showed some really good good results from PRP treatment with one of her male patients. My husband has a great head of hair, but he's starting to see some signs of thinning towards the back of his head and also at the crown. So we went in to go see her and talk to her about PRP. And her name is Dr. Zena Gabriel in Newport Beach. And when we went to see her, she surprisingly steered us away from PRP. She said that there isn't that much efficacy in PRP treatment, and they tend to want to treat internally and with topicals before they dive into PRP lasers and then, of course, ultimately transplant. So I wanted to share with you the regimen that she put my husband and myself on, because as you guys recall, I've called you guys before sharing my hair loss that I'm having, or not hair loss, but I have some hair thinning at the crowns of my front part of my head. So I wanted to share with you what she started us on. We haven't started using them yet because I wanted to run them by you guys to see what you guys thought, because I remember hearing from you guys in previous shows that some of the topicals could really fuck your shit up long term. So before my husband goes putting stuff on his head, I don't want his stuff to get fucked up. So I thought I would call and check with you guys first.
Okay. I like that.
So
that's good.
So for him, what she recommended was, first of all, he's on Nutrafol. So she thought she liked Nutrafol for men and not for women for some reason. She said that Nutrafol works better with men than it does with women. So she wanted him to continue on Nutrafol. And the other thing she wanted him to start was a compound that they make in their office. We're not in their office, but they make it. Someone must make it for them, and then they sell it. And so the combination of the topical, so the topical that they're making is finasteride, minoxidil, and tretinoin.
Right.
And I'll give you guys the percentages. So let me just get my Yorkie. Sorry, this happened the last time I called you guys. The doorbell rang and she went nuts. So the percentages of the ingredients are: the finasteride is 0.1%. Right. Minoxidil is 8%, and tret is 0.0125%.
Okay, so I'm going to give you my opinion based on not being a physician, but being in this field for a long time and knowing basically every possible combination of compounding FDA-approved ingredients into these hair loss concoctions. Back in the day, there was a doctor by the name of Richard. Was it Richard Lee? Joe, do you remember this guy, Dr. Lee? Out here in Los Angeles. And he was really one of the first guys to do compounding, mail order essentially, subscription-based compounding topicals, like using minoxidil with different ingredients, including retin-A, tretinoin, azelaic acid, and he was also one of the first, actually the first guy to use topical finasteride. He ended up getting kind of, I guess the state of California cracked down on him, but this guy was actually helping people many, many years ago. And but since then, every doctor at some point, and it's happened more recently en masse, is creating their own compounded products. And they're essentially finding a compounding pharmacy. They're asking the pharmacy, what do you think? What are you doing for other doctors? And they're all essentially putting out the same product or maybe adding a little something different. Some people may be adding some antioxidants. Some people may be using different percentages of finasteride and different percentages of minoxidil. So this is not something special. I just want you to know that. And it's also something that you can get compounded from any pharmacy or any physician who's willing to compound it. 8% minoxidil is relatively high. So I'm based on and again, we're not doctors, based on what you're providing, the information you're providing, maybe he'll get a boost from the minoxidil, possibly, but 8% is pretty high. You know, really the recommended dosage is 5% for men. And 0.1% topical finasteride is pretty low. So, you know, given that topical formulation that she's providing, if it were me, I probably wouldn't go that route. Now, I just got a text from somebody who said that they thought that Dr. Lee was providing at 1.15% topical minoxidil. He was. And he was a guy who was playing around with all different percentages of minoxidil, but he was compounding things that didn't have propylene glycol, so people were having better long-term results and not dealing with dermatological issues. But I guess my point of bringing up Dr. Lee was that I've kind of understood the compounding game for about 25 years, how it works, where these ingredients come from. A lot of times these ingredients are not, you know, they could be coming from China or India. You're not necessarily getting drugs put into these compounds that are, you know, you don't know how effective they are. That's just the reality of it. So I know that was long-winded. I'm going to let Joe speak, but I'm always kind of wary, especially when it's someone who doesn't necessarily specialize in hair loss and who has a really big dermatology practice, who's doing Botox and facials and, you know, lasers and all kinds of other things.
Yes.
So
I agree with that, Spencer. And Joe, I do want to hear your opinion, but I do agree with you, Spencer, with respect to, you know, hearing what a dermatologist has to say about hair loss for men, right? There's only so much they're going to know because they don't specialize. It's not all that they do. They're doing skincare, they're doing lip injections, they're doing, you know, the full gamut of things. So that's why I wanted to call you guys and run it by you guys first.
Just in case, you know, this gets out there, she may be a fantastic dermatologist. She may be a great diagnostician. She may do great with skin cancer. She may be great with, you know, doing, you know, laser resurfacing and all the, you know, the injectables, all that stuff. But that's the point. And so basically everyone, they go to these conferences and they're like, okay, how can we create different streams of income for our practices? And this is what you can do. Now the big thing is oral minoxidil or topical formulations of finasteride, minoxidil, you know, and different ingredients. You know, these companies that are on television and advertising everywhere online who are providing these subscription services really kind of, I guess, that was kind of like a tipping point for doctors to say, listen, why aren't we doing this? And in the last 3 or 4 years, every doctor is providing their own compounded concoction, or dermatologist, I should say. So, Joe, go ahead. Why don't you touch on this?
Well, my first question is, why did this doctor not recommend oral finasteride for your husband?
Sorry, he is on oral finasteride. So sorry, yes, that I did leave that out. He had already gotten oral finasteride from his naturopath doctor, so he had already started taking that. We told her that, and she said, yes, you need to continue with that. He he started last week.
Oh my God.
Okay. And she said to continue on that, but she said do not take the. I'm sorry. Continue taking that and
add this
in the topical.
Yeah, and buy our stuff.
In conjunction with the oral.
Yeah. Carolina.
Bad idea.
This could fuck your shit up.
Yeah, that's what I'm saying. That's what I'm saying.
Yeah. Reminds me of an old SNL skit, Bad Idea Jeans. This is a bad idea. Sorry, it's a very obscure reference.
Overload, right? It's too much.
Bad idea, yeah. Well, not just that, but It's like, okay, so say that your husband starts taking it, and then 6 months from now, he's got like this big bouffant of hair, and you're like, wow, great. Which one's causing it?
Yeah.
Which resource that you're using?
I better
is
keep
it the
buying
oral
this
finasteride, or is
concoction.
it this witch's brew?
Yeah.
Yeah. It's like you have no idea. I would put this in the cupboard behind behind the old bottle of hairspray that you haven't finished 5 years ago, and all this other stuff that might be up there, and just forget about it. Like, you already bought it. Just don't bother with it. Just count it as a lesson learned. Continue with the oral finasteride. See how it works out, and evaluate in 6 to 8 months.
Yeah, and the thing is, you could always add to the regimen in a year and say, all right, you know what? I think I'm, here's what will likely happen. How old is your husband?
He's 48.
Okay. So he's just going through kind of the initial throes. He was just put on finasteride. He has no idea how his body's going to react to this drug. It's probably going to be positive, but, you want to not, even stuff that you put on your scalp, you're going to have some systemic absorption. That's how it works. So you really want to put as little medication into your body as possible.
Right.
Finasteride, and again, we're not physicians. I have to keep saying this in case someone takes this clip out of context. We're not physicians. We're not giving medical advice. But, you want to hit it at the hormonal level first. And the most effective way that we know of now in medicine is to start with finasteride. And if you want to mitigate possible side effects, you want to put as little different medications into your body at one time. So your husband could certainly add this concoction at a later date, or find somebody else to provide something that might be even more effective. I mean, 0.1% finasteride, it's almost the fact that that's even being prescribed while he's taking oral minoxidil makes no sense to me. It's such a tiny
that's
percentage.
What I thought.
Yeah.
It's pretty silly, actually. Yeah.
Yeah, she's just trying to make money by making a compounding product, and then the thing that's really working is the supplement. The finasteride itself, the medication, is what's doing the work. And
now let me ask you this. This is also important. So if your husband is taking Nutrafol, which essentially, again, it's a supplement, and I wrote a chapter many years ago that outlined my thoughts and a group of supplements that I kind of put together based on some studies that I had found. This is back in the 90s. About standardized extracts of saw palmetto, Pygeum africanum, stinging nettle. And part of me regrets putting that out there for public consumption, because once that book was published, everybody and their mother started to put together some product. So before then, there were like these benign prostate hyperplasia. They weren't called nutraceuticals back then, but supplements. And there was definitely proof that it lowered DHT. So theoretically, and I wrote it as a theoretical chapter, if you're lowering DHT using these herbs, then you should definitely be able to slow the progression of hair loss or stop it, just like finasteride for some people. And it works. It absolutely works. The problem is you don't know where these extracts are coming from. You don't know if they're actually standardized. And when it comes to some of these, let's just say, dermatologist recommended products, the only reason these products are recommended by dermatologists is because, well, there's a couple of reasons, but one main reason is they're able to, the companies are able to convince these dermatologists that they're going to make the biggest margins on their products if they sell it in their offices. And also it's based on essentially going to a group of dermatologists, asking them to fill out a survey. And if you're the company that gets the most surveys back that give it a thumbs up, then you are the one that could say that you're number one dermatologist recommended. With that said, sometimes when you combine saw palmetto and these other products that lower DHT from Nature's Pharmacy with finasteride, it's possible that you're going to have a greater chance of adverse side effects. So that's something that your husband needs to watch. If he's doing well on both right now, he shouldn't screw with it. But if he notices any adverse side effects, and don't tell him anything until he tells you, because you don't want to put it into his head. But if he notices any adverse side effects, the first thing that he should probably stop would be the nutraceutical, as opposed to the finasteride. Yeah, the Nutrafol.
Yeah. Thank you for that. Yeah, I appreciate that, Spencer. So he'll stay on the finasteride, and I will report back and let you guys know if he yields any results from that. And then what the doctor said is to come back in a few months and report back and let her know how it's going. And then from there, we can explore PRP if needed for a boost, or they have some in office laser device. I don't know the name of the laser. It's quite expensive per session, but I'll let you know.
Is it a laser or is it something called TED device?
Say that again, TED?
TED, yeah. TED.
It sounds familiar. I think that might have been it.
Okay. Well, that's not a laser, but I will tell you this. I'm not saying not to go back to this person, but there's a good chance that your husband's going to do fine on finasteride, and he's already seeing a doctor who's prescribed it. So let's talk about your situation.
Yeah. So here's what she recommended for me. I don't know if there's any women in the chat so that can benefit from this conversation.
I think there are.
I do have some thinning along the crowns of my hairline, and she says that for women, hair thinning is a totally different cause than men. For women, it's inflammation in the scalp, which causes the hair loss.
All right. So my advice would be to just chalk this up to a interesting experience.
Yeah, that's very diplomatic.
Yeah.
Okay.
Yeah.
But listen, that she prescribed for me fluoxetine topical, 0.05%.
So that's a corticosteroid?
So, yes.
Okay.
And then she also recommended Viviscal.
Holy mother of God. All right. How did you keep a straight face?
My jaw just dropped. And then the last thing that she recommended topically is Neogenesis. Have you guys heard of Neogenesis hair thickening serum?
Yes, actually. And it's funny, Women's Hair Loss Project's in the chat, and she's like, is this a doctor?
People in the chat are like, run away fast.
Run away. There should be a Carolina-shaped hole in the wall.
I have to say,
this is why I called you guys.
It's funny. I just wrote an article for Dermatology Times, and the Times asked me if I can provide a couple of references for some points that I was making. And part of it was an opinion piece. And I wrote them back. I wrote the editor back. And I said, listen, this is a unique specialty. There's a percentage of studies out there that I could cite that are essentially bought and paid for. And I know how these studies and how people are able to get published and why certain papers are published. I mean, it's just such nonsense. And there are so many doctors. And I'm not saying this person's a bad person. And maybe she's just being advised by her colleagues that this is what they do in their practice, or this is how they make money in their practice. I don't know. Mm-hmm. But as I explained to this editor, I said, at least 65% of the stuff that you see being published is nonsense, sadly. So even to refer to these papers, I think that I'm giving your readership misinformation for them to go to a paper and read about something that is kind of slightly, connected to what I'm writing about, but not really. Because all they want is references. Mm-hmm. They don't even care if they're real references. They want to be able to cite stuff. So I guess my point is, it's just amazing to me the level of bullshit artists, even in so-called mainstream medicine. I mean, dermatologists who are willing. It's not even about money. I'm sure it didn't cost you that much money, but they
$325 for the consultation.
Okay, so it did cost you a lot of money. But
I stand corrected.
Yeah, I stand corrected. But even that basic consultation, that the information that you provide me, if it's accurate, and I believe you, of course, but for her to say that it's a completely different process than it is for men in general, that's just incorrect. Now, there are different processes that happen, and women are dealing with a different hormonal balance, obviously, and there's different issues that may trigger androgenetic alopecia in women than in men. But most of the issues are very similar. Most of the causes, many of the triggers, and it just happens to present itself in general differently in women than it does in men. So you're dealing with inflammation is one of them, but DHT is certainly a major component in female pattern or unpatterned hair loss. Go ahead, Joe.
Anytime I'm talking to a woman that's telling me she's got hair loss, the first three things I throw out there is iron, thyroid, hormonal issues. Because while DHT can and does affect women, with male pattern hair loss,
right,
just
Joe.
like on men, I always even when I was in clinic, guys come in. It's like, okay, well, yeah, finasteride, DHT, 5-alpha reductase type 1, type 2, blah 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 blah. But with women, it's have you ever had a panel run for your hormone levels, your thyroid, have you ever had,
Ferritin, all that stuff.
All that stuff.
But I'm assuming, Carolina, at this point you already have after this time.
No, well, so I'm not losing any hair. I'm just showing some signs of thinning around the crown.
Yeah.
So I'm not losing hair, and so I do. We both, my husband and I, both get our blood work checked every 6 months, specifically with a hormone doctor, just to make sure all that.
And how are your vitamin D levels?
Great. Everything's great.
Okay, so
Other than this, everything's great.
that's great. So that's important.
So there is a possibility, and it depends on your future as far as how you want to deal with this. But if you said that your hair is thinning in the crown, meaning the back of the scalp where men get the round bald spot, then you might be dealing with a DHT issue just like men do.
Right,
and
slow.
you might qualify for a prescription for finasteride as well after you've spoken at length with your doctor about it, because it depends on if you ever plan on having children again, or if you have, or at all. I don't remember your age or any of those details, but it is routinely prescribed to women that are.
She said the ship has sailed.
That ship has sailed. Yeah, that is routinely prescribed by a lot of doctors for women whose ship has sailed.
Yeah.
And it works.
Yeah. Okay. I'll chat with him about it.
But but my advice would also be to find the most qualified
any other
physician.
doctor.
Yeah, any other doctor in the world. But man, she got you guys. I mean, here's the thing: you were smart enough to step back and say, "Hey, let's call the show and see what's up."
Let me tell you,
the real
we
experts.
left there. Let me tell you, we left that office, and the first thing I told my husband was, "We're calling the guys on YouTube because they're going to tell us it's great."
Well, I think
like, you're not putting anything on your scalp until we know.
Yeah, and it's unfortunate because the younger guys, I mean, they're going to throw everything at it, the kitchen sink approach, and people just end up. I mean, he may not have effed himself, but if things worked out, he would not know what was working. And frankly, there's no reason to put 0.1% finasteride on your head when you're already taking oral finasteride. Makes zero sense. And the whole synergistic effect of minoxidil and finasteride, there is credence to that. But he may never need minoxidil.
Yeah.
Being that he's 48 years old and kind of just going through the initial throes now means that he's got a really good chance of slowing or stopping the progression, maybe getting some regrowth, and maintaining that until you guys are in an assisted living place. So I'm glad you called the show because I think that your husband, at least, is in a much better position. And obviously, you already knew that you weren't going to do anything that she suggested for you.
Yeah.
I got to ask you, was the 325, was that for both of you at the same time to be consulted?
Well, it was just for him, but while I was in there, I piggybacked on the consultation and started asking questions about me, and she got a little testy about it. She's like, "Well, now I'm giving you a free consult." I'm like, "Bitch, it's $325. That's enough."
But I mean,
I'm already here.
It's so funny, man. Medicine. I mean, God, these people are supposed to be helping us.
Yeah.
I understand. Listen, I'm a capitalist. I understand what you need to do to make a living. But if you choose to go into the field of medicine,
you have to be a prick about it.
Yeah, but if you choose to go into the field of medicine, there has to be a part of you that realizes that people are coming to you for help.
Mm-hmm.
And then she got free feels all over my husband. She started grabbing his throat and his neck. She said something about she was checking his throat to see if there was any inflammation or any indicators of why he would have hair loss. And I'm like, stop touching my husband. She's just like roughing him up.
I'm waiting for you to say that she asked him to cough.
Yeah.
Turn his head to the side and cough.
She didn't do that, but she definitely did feel him up.
Wow.
So what did she charge you for her concoction?
So
and
her concoction was... Oh, you ready for this one?
I am.
The concoction was $378.
For a month's supply?
I'm assuming it'll last a month.
Oh my God! This is
the wrong line of work.
Yeah, that is really, really something, man. Look.
Yeah, I'm embarrassed.
I gotta
go.
No, don't
go. Listen, I gotta hand it to her, man. She's got the game down. She goes to these conferences, and she's going to one of these booths, and they're like, "This is exactly what you can make." They give you the graphs and the charts, and how much you could charge, and how desperate and vulnerable this demographic is.
Wait. One question: did she pluck a hair and stick it under a projector and show you the sebum buildup at the base of the follicle?
I mean, I would have been impressed if she did that, but she didn't even do that. We probably spent 10 minutes talking to her.
A lot of people are actually, and that's one of the tactics that that scam places will use to show you the natural physiology of a hair and claim that it's your pores are being clogged. And it's inhibiting the growth, but
look.
But
go ahead, Jim. Sorry,
you did everyone a favor by telling us what this cost, because I think it's like Spencer said, God bless her. Like if that's what she's charging, that's good for her, but completely unnecessary for you. And I'm so glad that you called because it was very eye opening and entertaining. And lovely to have you back on the show as well, because you're always great to have on the show.
100%. But in closing, I just want to state
guys,
this.
Always a pleasure.
In closing, before I let you go, I went to a dermatologist locally for another issue, and I didn't end up going with her. And she had like an entire display case of Nutrafol and all these. What are they called? When you walk in, it's anyway, like signs for PRP, from these different companies.
Yeah.
Sit down with her to talk about, this issue. Significant hair loss to the point where, this woman, she had really, really significant female pattern hair loss. Yet, when you walk into her office, she's selling all these hair loss products.
Yes.
Yeah.
My husband said the same thing about this doctor. Her hair was terrible.
There you go.
And she's the one selling this advice. Her hair was terrible.
You going to go get cosmetic dentistry from a doctor with black teeth? It's not going to happen.
It was probably inflammation.
Yeah, it's her inflammation.
Right. She was running low on her steroid cream.
Yeah.
Topical.
There you go.
Oh man, she took.
Well,
she,
you guys,
she
thank you
took.
so
she
much
she
for-
really. Oh, you're welcome. Listen, Caroline, this is a great
Yeah,
call. It's
absolutely.
so important that people hear these stories and don't feel bad. I mean, it was a learning experience, and you were able to share it with a lot of people, and you helped them.
Yeah,
Well,
absolutely.
you guys just confirmed what I was feeling and thinking, so thank you guys for what you guys do here.
Okay, Carolina. Listen, Carolina.
Our pleasure, Carolina.
It's Carolina, right?
Yes,
Okay.
Carolina, if I can correct you, actually.
Say it again.
Okay.
Carolina.
Carolina.
Oh.
Yep.
Catalina.
Yeah.
There we go.
You
There
can
you
correct
go.
me as often as you want. Listen, I really appreciate the call. Good luck and say hi to your husband.
I sure will. You
Okay.
guys take care.
Take care. Bye-bye.
You take care. Have a good
Okay,
weekend.
bye-bye.
I have to tell you, man, I mean, going to doctors for me, it's so effing difficult. It's so difficult. And I have to tell you, I've dealt with some things, you know, as you know, and, you know, it's just kind of like I have to, like, crowbar shit. I have to sit them down and basically consult them on their consultations and let them know, look, this is what I need done, and this is why. And I hate to even do that because when patients dictate medicine to doctors, in general, it's not a good thing.
No.
But I know that's the difference.
Yeah, that's the difference. You know, I was thinking it near the end of this call. Next week, Catalina is going to be walking back and forth in front of the doctor's office with a sandwich board.
Oh my God!
About this place. Yeah, she got an eye opening there. Great call though. God, it was awesome.
It is. Someone using a sawzall upstairs?
I hear it.
Unbelievable,
Wow.
man. Guys, the phone number is 888-659-3727. We do have lines open, so give us a call. I think that was a very valuable piece of content, a very valuable call for our listeners. I'm going to cut some of that up and put it out for the ladies out there. Maybe send it over. Well, I know that Women's Hair Loss Project always shares some good stuff on Instagram for her following. The vast majority of women that are seeking dermatologists, even specialists, even people who claim to be at the top of their field, are not being helped. You know why? I'll tell you why. Because in general, all these doctors do is maybe read a study, see a lecture, and talk to some other doctor who's making a fortune off of the vulnerability and preying on these vulnerable souls.
It's not even that in depth. A representative comes by and throws down a brochure and says, "Hey, want another revenue stream for your practice? Sell this." And they're like, "Okay."
Hair loss is so
I want
effed
some more
up,
money.
man. I got to tell you, you know, I mean, and we're going to take your call in a second, caller, so hold on, 888-659-3727. But, and this is not to stroke Yaker, but, you know, I was listening to him yesterday, and I listened to all your guests, and, you know, they're all great, but, you know, just the way that he was describing the reality of hair loss, like, look, you're going to be bald. At some point in your life, you're going to be bald.
He didn't pull any punches. Look, okay, you're losing your hair, and you're going to be bald.
Yeah.
That's out of the way. Let's talk about what
now,
we can do.
You could be possibly not be bald in the next 5 years and maintain some level of nice hair for the next 20, maybe 30 years if you're lucky. But you're going to be bald. We can't stop this. This is a train that we cannot stop. So eventually, you're going to have problems. So let's mitigate any possible damage in case you do have to shave your head sometime down the line, or whatever. And that is the honest approach. I've been on medication for 30 years. My hair's changing. I'm, you know, holding on to it every strand with, you know, my cold, you're going to have to like rip the hair out of my cold dead fists. But, if that makes sense, you know what I'm talking about.
Rip it out of your cold dead head.
Yeah. But I'm going to, you know, work on changing my meds up a little bit, increasing my finasteride use, Maybe adding some stuff to see if I could, help with some of the retrograde or the crown loss. I'm painting more now. But I knew that eventually, I saw the changes over the years, that it's going to come. I started early intervention before early intervention was even a thing.
Yeah.
And it gave me the ability to have the Trump the early years comb over thing for a very long time, and I'm very grateful. But there probably will come a day when I have to shave my head. Unless I drop dead or something before then. If I live to a ripe old age, that may happen, unless, we do find more effective treatments, and that's possible too.
Mm-hmm.
So when these vulnerable people, and especially women, come into these doctors' offices and they're like, yeah, well, we could do this, we could shoot you up with that, we'll give you this, here's some pills, here's some vitamins, do this, do that. They know what's happening. They know what's happening. They know the truth.
Oh, yeah.
And I think it's pretty telling that this dermatologist is losing her hair.
That's just special. Use this, it works. Does it?
But just the whole, yes, there are differences, and there are, and I'm glad that you brought up the blood work, Joe, because that's very important. But in general, I hate to say it, contrary to popular belief, most women who are dealing with hair loss are dealing with common androgenetic alopecia just like men.
Mm-hmm.
Fucking dermatologists, man. I got to tell you. And this article that I provided, brilliant, by the way, if I say so myself, will help a lot of dermatologists and also the readers of this journal, this magazine.
Mm-hmm.
And I understand the reasoning for references, for sure. And I explained everything. And very nice people, by the way, over there. So I'm not saying anything, but I'm just like, that is just the mentality, because these are not doctors. They're editors of this journal, right? And they believe that these published papers are real. They don't know how publishing in medicine works. Anyway, it's just unbelievable. Am I going to do this till I die, though, Joe? Am I going to keep ranting like a lunatic about this nonsense?
Well, I don't know, but the question is, will it be behind a microphone or on the corner?
It's possible at this stage of my life because I'm losing it. Let's see who this is. Hey, you're on the air. Who's this and where are you calling from?
It's Morty from Brooklyn.
No, it's not.
No, it's Rob from Michigan.
That was good.
I was like, wow,
Happy
Morty,
for about
man,
a
what, do you
quarter
take some
second.
testosterone or what?
I was going to say, you sound a little brutish.
What was that?
What's up, Spencer?
What's up, man?
I don't know. Joe's show's good. You disappeared last week.
Well, you know how
What's
I feel.
up with that?
Listen, Joe could do this shit on his own. I'm good with it.
Nah, we need both you guys.
Well,
we do.
The two students.
We need Spencer.
Well,
Yeah.
I'll do my best to stick around. So what's happening?
Yeah. I was just calling to see I'm going to match Joe here in July with 10 hair transplants.
No, you're not. Really?
Yeah, I am. This will be the last one.
Well, I'm going for 11, so sorry to bust your cherry there.
Well, then I'll go for 12 then. I'm kidding.
So am I.
This is just to fix a little bit in the crown, and that'll be it. And I know
that.
And Dr. Umar. I mean, I've had 2 procedures with him, and he is completely. The density is a hell of a lot better.
Mm-hmm.
And I
great,
thought
man.
that was good. So that's all I had to say. Just wanted to get that Morty thing in.
Well, listen.
That's the whole reason he called. That's great.
I want to wish you luck with your next transplant. Every transplant's a risk, as you know, but you've been through it 9 times already. So
Yeah, I appreciate it. So, thanks, guys. Keep up the good work. Joe, show is great, and I hope you guys have a good weekend.
All right, man. Take care, brother.
Thanks, Rob.
See ya.
Good hearing
Bye-bye.
from you. Have a good weekend yourself. Bye-bye.
Thank you.
I think
That was good.
someone's trying to cut a hole in my ceiling.
I hope not. And I hope there's not heating elements somewhere below their floor. That'd be bad too.
Yes, it would be. 888-659-3727. Yeah, they have the heated floors in the I shouldn't talk that much, I guess. But yeah, they're heated floors. Anyway, let's see who this is. Hey, you're on the air. Who's this and where are you calling from?
What's up, y'all? It's Hampton from Georgia.
Hey, man, what's happening?
Hey, Hampton.
Hey, how are y'all?
I'm okay. I'm a little disturbed by the construction that's going on right now.
Now you know what I was going through. Now you know what I was going through a few weeks ago.
But I didn't even get a warning.
It was coming through my ceiling. It was 6 floors up too.
So what's happening, man?
Anyway,
Not too much. I wanted to just touch on a few things I've heard. Just listening to Joe.
Hang on, Hampton Hudson.
Yes, sir.
Okay, I'm glad you called because I actually thought of you.
Because I got a bone to pick with you, Hampton.
I got a bone to pick with you. No, I wanted to clarify something I was saying yesterday on the show, where you asked in the chat room and then in DMs later on about the claim of 99% growth at 4.5 months. And
yes, sir.
What
yeah,
I
recently.
said, yeah, what I said was that's for more or less. I said it's poppycock. It's like, who can say that? But what you didn't share at the time, at least on air, was that you had been given regenerative medicine treatments along with your surgery, and so in that situation, I need to pull that back because I can't comment on the efficacy of that regenerative treatment that you had in relation to your surgery and the amount of sprouts that you'll have at 4.5 months. So I wanted to clarify that. I'm glad you called because it reminded me of that. I wanted to get that correction in there. What I was saying is that in general, like just a flat out surgery, like a normal surgery, hair transplant without any sort of ancillary treatments, no, 99% at 4.5 months. It's kind of silly, but I can't say that if you've had a quality regen treatment because I don't know enough about it. So I want to get that clear. All right.
Yes, sir.
Make sense?
Gotcha.
He's like, what are you talking about? I just called to say
no,
hello.
I'm totally following. I had basically PRP done, and I didn't know if, I assume that's pretty common, along with a hair transplant. So I didn't know if it would speed up the process by that much.
Now, was it included in the transplant, or was there an extra charge for it?
Extra charge.
Yeah.
A stout one too.
Yeah.
At that.
We could do a transplant, but if you really want it to work better,
I know
we're going to charge you for PRP. I mean, think about that shit.
Yeah,
it's just unbelievable to me. If the doctors really believe that you're going to get a better end result, it's better for their practice and it's better for their patient, just to work it into the price. Don't even tell them that, and then just say, "Look, we do this along with the surgery," and that's it.
Yeah, that'd be nice for sure. What I wanted to ask y'all though is, are you kind of noticing like a topical finasteride or dutasteride, wave? I know I'm on it myself. I'm on topical finasteride.
Yeah.
But two of the several doctors Joe's had on have made the statements, the claims that they're seeing better results with it. Not just that, it's less systemic or whatever, but they're actually seeing more efficacy. So I just wanted y'all's take on that.
I don't necessarily think that. I don't think that we have seen topical finasteride in any, standardized application compared to, say, oral finasteride, where you can really judge which is going to be or if in fact topical is going to be more effective. That's just how I feel.
Right.
I don't know. I mean, the practice of medicine is unique. Everyone's doing their own thing in their own practice. In one person's practice, they may be providing more topical medication, and they're noticing, holy cow, we don't have to give these guys pills, and we're seeing results. And that's their interpretation of we're getting better results with topical. I don't know, Joe. What do you think? I'm being diplomatic.
Because there's no standardization on topicals, I am seeing some formulations apparently are pushing out some really good results, but I can't say that the patient wouldn't have had the same result with oral. I don't recall anyone saying, look how great this result is on topical. This is what it looked like after 5 years on oral, and it's so much better. That's the real metric. Because you can't take 100 random guys that have never been on a DHT inhibitor, give them topical, and say 75% of them turn out with like this really nice turnaround, and say, look how great my topical is, unless all of them were on an oral version of that same medication for a legitimate amount of time to say whether or not it was effective before they switch.
So what he's saying is he's not saying the doctors are bullshitting you.
Right.
But what he is saying is we really have no idea.
I got you.
But what I can say is that it is absolutely effective for a lot of patients, no question about it. I've seen some makers of specific formulations sharing
100%.
their results with me, and it's like, wow, that's pretty damn good.
I know one in particular.
Pretty impressive.
We're not going to mention the name now, and just like, all right, this works. This is working. Seems to be the right formulation for the average patient.
Yeah.
But I think the good thing about going to a physician who's working with a good compounder and really resourcing or sourcing the product from, I don't know, the U.S., for instance, and, really kind of can possibly, if needed, especially if you're going to that doctor as a patient, can up or lower or change the combination or change the compound a little bit just for you if needed. I think that is valuable. And you just can't get that from these large box subscription services, which again, for me, those places are a double-edged sword because I love the fact that young guys now, even though half of them don't even know they're on it, are back on finasteride. Because they were so scared of taking Propecia. It's like, I'd never take Propecia, but I'm all in for keeps. It's like, it's like, listen, brother, you're taking this, it's the same thing, basically.
Yep.
So, yeah, man, the answer is nobody knows. But if you're doing well on it, and people do well on it, then keep using it.
Yeah, man, I'm still kind of experimenting. I just went from 0.1% finasteride. I'm on 0.5 now, so trying to see if I can get more growth on it.
Are you taking oral?
No,
okay.
Topical.
So 0.1% to 0.5.
Yeah, so pretty much that's the equivalent of 5 milligrams of oral.
Again, I don't want to put it out there, but that's what the claims are.
Right.
There's no one that's really conducting these studies. Joe, what do you think?
Well, it depends on the delivery
source.
vehicle for the absorption.
Yeah. And
like how much of it's actually being absorbed. And the source, of course. See what I did there?
Kind of.
But I think, I think a lot of it has to do with trying to get through that barrier that's called skin. And I can't believe someone in the chat room said with a hydroalcoholic delivery, you mean water and alcohol, that almost all of a 0.1 would actually absorb and be equivalent to 1 milligram of oral.
Where is Killian the chemist when you need him?
Yeah, exactly. Good question. But yeah, I mean, how much of it is getting past the hair? It depends. Okay, classic problem I have with classic. Problem I have with some of these thicker formulations, when you, I don't know why I said that, where you have a lot of hair and you're just trying to thicken it up. How is that paste, that thick paste, getting delivered to the scalp and not getting stuck in the hair? Whereas you have a thinner, more liquefied delivery, that's getting down to the skin, and then it's a matter of it, of all of that being absorbed. Is it all being absorbed, or is it some of it drying and or staying on the scalp and just becoming residue? Like I can't believe all of it is actually absorbed.
It's not. It's not, and no one else knows if it is either. And if they are testing it, they're testing it on a bald scalp.
Yeah, it's definitely a trial and error thing from what I've learned. I went from the paste to a liquid formulation now, so I am hoping that, because like Joe said, it definitely gets caught up in your hair, and how much is actually getting on the scalp, who knows? But
100%, man. That is the biggest problem. And look, everyone and their mother is now selling these products. And again, I have mixed feelings because I do think that at least these younger guys, especially, are being reintroduced to finasteride and dutasteride. In many cases, these companies are selling both topical and oral. And a lot of guys are taking oral finasteride now. And you know what's interesting? A lot of guys who are taking, like, I don't know, Hims or whatever, they're not even putting two and two together about the side effects, so you're getting less complaints. The whole thing is screwy.
Yeah.
Now I got a phone call coming in. What's going on, Joe?
I wanted to ask y'all about one more thing before I go. It kind of concerned me. I was listening yesterday. Dr. Yeager is awesome, by the way. It's the most down-to-earth doctor I've ever seen on the show, so that was awesome.
He's the best, man. He really is. I'm upset that Joe had him as a guest.
So genuine. But I was super concerned. He kept talking about testosterone, and I know we all know that DHT is the main, is the devil here, and that's what's killing the hair follicle, and that testosterone is also an androgen, so there's some kind of damage done there. But he was really emphasizing high testosterone levels, and I myself, got a hair transplant 5 months ago, been on this topical suppressing my DHT, but I have a 900 plus test level, so I'm just wondering if that's.
But he was talking about using or people who are on TRT therapy, exogenous hormones that are introduced to your body.
A few times we need to drive that down. So is that what he meant? If somebody's on TRT, kind of less.
Yeah, absolutely.
Reduce the dosage. Yeah.
Like, for instance, and I'm not going to get into specifics about my chemistry, but I apparently have a pretty high testosterone level, especially for someone my age, right? But I would love to get on TRT because I know how jacked I could be at this stage of my life. It would be ridiculous. And I know I'd feel better, and, Joe wouldn't depress me as often, and, everything would just be, just great. And I'd love to do it. I'm in a stage of my life where, like, why not? And I'll tell you why not. Because I don't want to lose the rest of my hair. And I think, I was going to call him Joe. Dr. Yeager is absolutely correct. You see a lot of older men who are put on this standard regimen from these hormone hacks, I call them. I sound like Trump when I just said that. These hormone hacks. And, everyone's putting everybody on the same dosage, and they're not titrating them correctly. And that's the problem. You see all these guys who are like my age, all of a sudden they're walking around, it looks like they have, female pattern hair loss or, diffuse hair loss as opposed to a stronger male pattern. And that's TRT driven. And it is an epidemic, especially here in Los Angeles. You see all these guys with the dyed beards, and they slick back their hair with dyed sides and the really thin tops, and they're super jacked. So, yeah, I know I just went off on a tangent, but that's what he was talking about. At least, I don't know, it's your show, Joe. I could be wrong. I was working out, actually, when I was listening.
You're right. Yeah.
I never heard him say TRT, so I was under the impression he was talking just in general, let's work on. But which wouldn't make sense. I mean, why would you lower your natural testosterone, and how the hell would you do that anyways without really messing with yourself? So
Yeah, they wouldn't do that.
I just misinterpreted it as him saying we need to get those test levels low, and I was just thinking, wow, that's the total opposite of what we want to do as men.
That's 100% correct. And
Yeah,
and
but
you know,
driving those test levels up shouldn't be a bad thing if you're on a 5-alpha reductase inhibitor.
yeah, it
right?
shouldn't. It
Because
shouldn't be,
the
right?
test
Right.
Your hair is that conversion.
Yeah,
shouldn't.
it shouldn't.
Yeah.
But I've been on a 5-alpha reductase inhibitor for almost 30 years. And I'm about to up my dosage. I'm bringing more into my week, meaning that instead of taking it, I was doing it once a week, 5 milligrams, and then I upped it to about every 5th day. I'm probably going to up it to every 4th day, and then I may end up closing that gap even more so that I have more in my system. I know everyone's like, the half-life is only, whatever, 6 hours or this and that. It's not in your body for more than a day. Once you've been on it long enough, it's basically like taking anabolics, and you keep your DHT levels low, and they don't kick back up to normal levels for at least 2 weeks. So you're still lowering your DHT significantly with intermittent therapy. And there's not a doctor on the planet, well, one, that will agree, but it's just the way that it is. But yeah, man, I would love to listen to you and say, you know what? Hampton's right. I'm going to go to the doctor. I'm going to get on TRT. You're going to see me in a month, and I'm going to be like, I'm going to be busting down in my shirt. But what probably happened to me is you'll see me in 2 months. I'll be busting down in my shirt, and you're going to be able to see what I'm thinking. My hair is going to be so thin.
Oh, yeah.
So I'm willing to take the chance in time. But right now, I'm just not. There's other drugs that are out there on the market. A company had contacted me that's selling kind of like it's kind of like a derivative of Clomid, which you actually increase your testosterone to a certain point, and you're still making your own testosterone. And there's a couple of companies now, but there's one company they're claiming that's hair friendly, and they want to work with the American Hair Loss Association. I'm just like, man, I got to see more evidence.
Yep.
And I think this person. Well, he did say that he heard me speaking about this on some platform. I don't know if it was Instagram or whatever. And he's like, "We can help you. You can raise your testosterone without losing your hair." I'm just like, "Go after yourself."
We can help you, Spencer.
We can help you as long as you pimp out our product
with your problem.
Yeah. All right, brother, man. I hope that helped.
Yeah, for sure. It did.
All right, man. Good luck. Thanks for the call. Bye-bye.
Thank you.
Keep listening to Joe's show. That's all I'm saying. All you guys, my hope is that Joe can do this by himself on Fridays in time.
Not just last Friday, but every Friday.
I just got to get out of here, dude.
But also, I need to remind people that if you're not subscribed, hit the subscribe button. Ring the bell for all notifications so you're notified of my show and this show every Friday. But also hit the like button, people. We got 34 likes right now. I want to see 40. We don't have much time left for the show.
No, what I want to do is... Go ahead, Joe. Sorry.
I need to address Broderbond 60. He says his eyes are finally adjusting to my Bordello lights. My question to you, my friend, how do you know what Bordello lights look like?
I think every man over the age of 20 knows. 888-659-3727. I don't know if we have time for a phone call, but if we do, if you call, we might take one real quick. They just hung up. We had no call. So, but what I want to say is I threaten to do this all the time. It's not that I want to leave. It's not that I just want to have the option, A. And I also like, this is what I like about what you do, Joe, that I don't want to do. It's not that I don't like these doctors. That's not the point. I just don't want to sit there anymore and just talk to physicians about the same stuff that we talk about all the time. I like to delve more into the emotional aspects of hair loss on a personal level. Like when I started the Bald Truth many, many years ago, that was really the emphasis. And when it was on the radio, at least the first few years, the show really did well. It was a lot of fun. And we were really talking about a subject that people weren't allowed to talk about. And then it became almost like internet-fied, like people were talking about the minutia of the surgery and, just all the stuff that, you're really good at. That's great. And, getting answers from the doctors. And people love that. It's important that we provide that through our platform and our joint platform. It's not really a joint platform, but, we're all kind of working together to get the information out there.
Our parallel platforms.
Parallel platforms, exactly. But I would prefer to do something where we're just talking about the emotional aspects of hair loss. And I would love to be able to turn the bald truth back into that. And I think we do still have that to some degree.
Oh, yeah. Yeah, we do. For sure.
But our friend from Newport, Carolina, who I probably mispronounced that again. Catalina. That's an important call. It's a great call. It's empowering for not only with the women who are listening, the 10 women who are listening, but all the guys out there. And it really just shows you, I got to say, what's happening here. I mean, it's happening all over the country. What's happening in Beverly Hills and Century City and Newport Beach. Newport. All these fancy schmancy places, man. It's criminal. Absolutely criminal. These people, I don't even know if it may be unwittingly. I don't even know, or maybe it's just kind of like a wink and a nod situation. They know, like when I went to see this dermatologist, come on. If your PRP that you're offering people works so well, how would you be walking around like that? And that's nothing.
Fair question.
It's a very natural. Listen, it's an unfortunate thing that happens to us. Hair loss sucks. And this isn't to I would never name this person, and she was very nice. But come on. That's it. Maybe change your PRP protocol, because if you're using the same PRP protocol that you're providing patients, it ain't working, sister. I can tell you that.
There's an easy answer to that. She could say, "Well, I had no hair. This is what I'm growing back so far."
Yeah, that's actually very funny and kind of sad.
You never know.
That's true.
You never know. Yeah,
that's true. So I guess we could say that for the dermatologist in Newport Beach as well.
Yeah. Not saying that that's actually happening, but that could be the rebuttal to, well, if it's so good, why are you in this situation?
What kind of a human being would actually say to somebody, look at you? I know there are human beings out there who would.
A lot of patients. I can't count how many times. Oh, I want to get a hair transplant from a doctor that has Norwood 3 temple recession. I want to get a hair transplant from a doctor that's a Norwood 19.
Yeah, but what I'm saying is they're not going to go up to they're not going to go up to another human being, at least most caring, normal people, and say, "Look, your hair's effed up. I can't trust you." They may say it behind the scenes or online.
Yeah, I guarantee it's been said
now
in an office.
Somebody will say that. Somebody will say that crap to me in person. I once had a guy who, and this is early in my career, who was begging me to meet him. This is in New York City. And I was young. I was 32 or something, or 30. I forgot, 31. This kid was 25, and he was totally depressed, and he wanted to meet me. And I'm just like, all right. I met him at this coffee shop. And this is going to sound obnoxious, but this waitress was flirting with me. And he says to me, right to my face, he's like, "It's amazing you could pull women with hair like that." Okay. Those were his exact words. God. It's amazing that you could pull women with hair like that. I said, "Brother, that's why you can't pull women."
Wow.
Yeah. I made him pay the bill. I had grilled cheese and bacon. It was really good. All right, guys, we have no phone calls. So we're going to go. I want to thank Joe Tillman for allowing me to participate today It's a lot of fun.
Welcome back.
Thank you so much. It's good to be back. Don't forget to watch the main event. Get it? Every day, Monday through Thursday.
I still hear that every time I say it now. Get it?
Monday through Thursday, right here on the Hair Transplant channel. If you're listening to this broadcast, if I happen to put up a podcast, maybe I'll do it this week. If I happen to put up a podcast, if you're listening to this broadcast right now on Spotify or wherever, go to youtube.com/hair transplant mentor. That's the Hair Transplant channel. That's Joe Tillman's channel. That's where we put this program, and this is where we air it live. Subscribe to the channel. Just do it. It's not a big deal. Ring the bell so you can get notifications when Joe is live and when The Bald Truth is live and when Joe puts up a video. Spread the word about that channel. Help your hair loss brethren get the truth. Because let me tell you, they're getting effed up. Your friends are getting screwed up. Your family members are getting screwed up. Did you hear the story from this lady who took her husband to get help from a doctor in Newport Beach? Top of the line, supposedly.
That was amazing.
And the bullshit that she came home with. So that's youtube.com/hair transplant mentor. It's a whole thing, though. It's so confusing. And it's the Hair Transplant channel. Subscribe to the page. Joe Tillman does the main event every day, Monday through Thursday. It's a live broadcast. He has a lot of great guests, leaders in the field,
More to come.
IAHS accepted members, and Hair Transplant mentor, most spectacular doctors in the world members. But real doctors who actually know what you're talking about and are there to answer your questions. Follow me on Instagram, people. I'm trying to build that thing. I put out stuff a couple times a week. It's good content. And if you share that content and follow me, it's only going to grow. And you're only going to help people. I don't make any money from it. Just do it. It's not a big deal. You're not going to see before and after pictures of IHS doctors. We're not pimping anything out. It's not what I do.
Accept the truth.
Accept the truth. We are pimping the truth. Until next time, guys and ladies, be strong. God bless. I was going to say something. And thank you so much for listening. Take care.
Thank you very much. I'm sorry for any inconvenience you may have been put to prior to the program, and I'm glad you enjoyed it. And if you could now leave by the exits at the rear, that'd be splendid. Thank you. Good night.